Hello and welcome. I'm Dr. Kerry King. I am the medical director here at the Bioskills and Simulation Training Center at Naval Medical Center, San Diego. Briefly, what we do here is the old approach to training folks to take care of patients involved the apprenticeship model, where they watch one, then they do one, and eventually teach one. Well, here we give them the opportunity to watch one and then do one 10, 15, 20 times, however many times it takes for them to feel comfortable before they have the opportunity to actually take care of a patient. So with that said, I'd like to welcome you on our virtual tour here of our simulation center. So medical simulation can involve anything from a full life-size computerized mannequin to some things that we use much more often and don't have the fancy high fidelity to it, but are equally important as far as teaching people how to take care of patients. And an example here would be what we refer to as a simple task trainer. So this is a model of an arm that nurses, corpsmen, doctors will use to learn how to put in IVs. A very simple technique, but one that everybody has to know and has to be able to do it correctly. And again, they can practice as much as they want before they have to try this on a patient. Next, we have what is essentially another task trainer, only here the task is a little bit more complex. It's set up just as we would do with a real patient, and this is something that someone would train on if they needed to do something like a spinal anesthesia, or you've heard the word spinal tap, which is a very important technique that many doctors need to be able to do on their patients. And here is where they have the opportunity to train and get those skills down before they have to try it for real. And just moving down the line, this is what we call an intubation trainer. So many times folks, for whatever reason, will need help to breathe, and we have to put in what's called a breathing tube or intubate. This just small piece of a mannequin has all the exact anatomy that we would find in a normal person, and the doctors, nurses, paramedics can come in and they can practice the skills of getting that breathing tube in so that when they need to do it in an emergency, they've got it down cold and they don't have to stop and think about what they're going to do. One more example of a task trainer. This is a piece of equipment that we use to teach folks how to put in what we call central IV catheters. They're big IV catheters that have to go into one of the big veins in the body. And as you can see, it has very large needles and very large catheters that are meant to go in. This is a model of a neck, and they go into a big vein on the side of the neck. As you might imagine, that can be somewhat of a delicate and difficult procedure, and this is one of the places where we really want them to be able to have the opportunity to train and practice as much as they need so that they feel comfortable when they have to approach a patient for the first time with something as complicated as this. This is what most people think about when they talk about medical simulation. It's a full life-size mannequin. It's computerized and hooked up to a computerized control board so that we can make the mannequin breathe, we can make the mannequin talk. It has a heartbeat, it has pulses and blood pressures so that the people who are training on it get the feel that they're taking care of a real patient. And what we've done here is something that we call moulage, which is essentially putting makeup on the mannequin. And this particular mannequin is set up as if it's been involved in some sort of significant trauma like battlefield trauma. So they can look at the burns on the face and think about the way that needs to be taken care of, and they can do all the appropriate procedures required to take care of that burn. They can look at the evidence of injury and burn on the belly and think about the problems associated with that, and then they can do the procedures on the mannequin to take care of that. And even some of the more visually interesting and somewhat horrifying things like an amputation, they have the ability to put tourniquets on. We can even make the mannequin bleed, and they can control the bleeding with a tourniquet. So a much more involved, much more complex approach to both decision making and doing the tasks that they've trained to do on perhaps small, simple task trainers before. They're now going to put it all together in the ability to take care of a severely traumatized patient, particularly something like battlefield trauma. And we've got something here that may not come to mind as a simulator when you look at it at first, but it's an actual body-worn simulation training device. It's called a cut suit. And this is something that a live actor can wear particularly when we're doing very complex battle type scenarios with somebody getting injured. And here you can see that they've actually moulaged this up, made it look like, put makeup on it, make it look like somebody actually has been impaled by objects that exploded. In this particular suit, the surgeons can actually do surgery on the suit. In fact, you might be able to see that there's a scar here from a previous surgery that this patient has had. But by putting an actor in the suit so that they can give immediate feedback and response, whether it be for pain or telling somebody what's wrong with them, and then combining it with a suit that they can actually put needles in, can actually cut and operate on like a real patient, takes it to what we call the higher levels of fidelity, the higher levels of realism that make this sort of training so valuable to our surgeons, doctors, and nurses. Finally, one thing that I'd like to show you as we finish up our tour here. So this is a mannequin that actually delivers a baby, because in the military we have to take care of a lot more than just people who are hurt and traumatized in battle. We have to take care of families from the day they're born up until they're a ripe old age. So one of the things that we do here with this particular mannequin is, again, you can have somebody actually deliver a baby and learn that skill set. You can have somebody take care of the mom who's having difficulties while she's delivering a baby, and you can have an entire team of people training together, the obstetricians, the pediatricians, the nurses, and the corpsmen, and it gives an opportunity to figure out how they're going to do things together as a team when they're faced with those same problems when they see them in a patient.